Hello and welcome. Today, we're shedding light on a rare but important topic, conjunctival lymphoma. This condition affects the conjunctiva, the clear membrane that covers the white part of your eye and the inside of your eyelids. We'll explore what it is, why it happens, how it's diagnosed, and what treatment options are available. While this is not meant as medical advice, we hope this information empowers you with knowledge and understanding. The exact cause of conjunctival lymphoma remains somewhat elusive. Unlike some cancers, a single, definitive cause hasn't been identified. However, research suggests a few potential contributing factors. Some studies indicate a possible link with chronic inflammation of the conjunctiva. Others explore the role of genetic mutations that could predispose individuals to developing lymphoma in this area. Certain environmental factors, although not clearly defined, are also being investigated as potential triggers. It's important to remember that, in most cases, it arises spontaneously without any known risk factor. Conjunctival lymphoma arises when lymphocytes, a type of white blood cell responsible for fighting infection, undergo uncontrolled proliferation and accumulate in the conjunctiva. These abnormal lymphocytes disrupt the normal tissue structure, leading to the formation of a tumor-like mass. The lymphoma cells can be either B cells or, less commonly, T cells. B-cell lymphomas are more frequently observed in the conjunctiva. The growth of these abnormal cells can cause various symptoms, as we'll discuss later. The disease can be localized to the conjunctiva or, in some cases, spread to other parts of the body. Conjunctival lymphoma is considered a rare disease. Precise incidence and prevalence data can be challenging to gather due to its infrequent occurrence. It tends to affect adults more often, typically those over the age of 50, but it can occur in younger individuals as well. There is no significant difference in incidence between males and females. While it can occur in people of any ethnicity, some studies suggest that it may be slightly more common in certain populations. The rareness of this condition underscores the importance of awareness and prompt diagnosis if symptoms arise. The symptoms of conjunctival lymphoma can be subtle initially, often leading to delayed diagnosis. The most common sign is a painless, salmon, pink-colored patch or mass on the conjunctiva. This mass can vary in size and shape and may be located on the bulbar conjunctiva, covering the eyeball, or the palpebral conjunctiva, lining the eyelid. Other symptoms might include persistent redness of the eye, a feeling of grittiness or irritation, mild discomfort, and, less frequently, blurred vision. Because these symptoms can resemble other common eye conditions, it's crucial to consult an eye doctor for a thorough examination if you experience any persistent or unusual changes in your eye. Diagnosing conjunctival lymphoma typically involves a combination of methods. First, a comprehensive eye examination is performed by an ophthalmologist. This includes a detailed assessment of the conjunctiva, eyelids, and surrounding tissues. If a suspicious lesion is found, a biopsy is performed. A small sample of the affected tissue is surgically removed and sent to a pathology lab for microscopic examination. Pathologists will analyze the cells under a microscope to determine if they are cancerous and, if so, what type of lymphoma is present. Additional tests, such as imaging studies like CT scans or MRIs, may be ordered to assess whether the lymphoma has spread beyond the conjunctiva. Conjunctival lymphomas are primarily classified based on the type of lymphocyte involved. The most common type is extranodal marginal zone lymphoma of mucosa, associated lymphoid tissue, or MELT lymphoma for short. This is a type of B-cell lymphoma. Other less common types include follicular lymphoma, diffuse large B-cell lymphoma, and T-cell lymphomas. Knowing the specific type of lymphoma is critical because it influences treatment decisions and helps predict the prognosis. Treatment for conjunctival lymphoma depends on several factors, including the type of lymphoma, its stage, and the patient's overall health. Localized disease, meaning the lymphoma is confined to the conjunctiva, is often treated with radiation therapy. This involves using high-energy rays to kill cancer cells. Another treatment option for localized disease is surgical excision, where the affected tissue is surgically removed. In some cases, chemotherapy, either topical or systemic, may be recommended, especially if the lymphoma has spread beyond the conjunctiva. Immunotherapy is another treatment modality that uses the body's own immune system to fight the cancer. The ophthalmologist will work closely with an oncologist to determine the most appropriate treatment plan for each individual patient. Unfortunately, there is no known way to definitively prevent conjunctival lymphoma, primarily because the exact causes are not fully understood. However, maintaining good eye health through regular eye exams can help detect any abnormalities early on. If you experience any persistent eye irritation, redness, or unusual growths on your conjunctiva, it's important to see an eye doctor promptly for evaluation. While these symptoms may not be indicative of lymphoma, Early detection is always beneficial for any potential eye condition. The prognosis for conjunctival lymphoma is generally good, especially when the disease is diagnosed early and remains localized. With appropriate treatment, most patients achieve complete remission. However, regular follow-up appointments with an ophthalmologist and oncologist are essential to monitor for any signs of recurrence. Recent research is focusing on developing more targeted therapies that specifically attack lymphoma cells while minimizing damage to healthy tissues. Scientists are also exploring the role of the immune system in fighting conjunctival lymphoma, which could lead to the development of novel immunotherapeutic approaches. Further research is continuously improving our understanding of this disease and leading to better treatment options.